We're here this afternoon to examine critical programs within the U.S. Department of Health and Human Services that are also essential to upholding the federal government's trust responsibility for the health and well-being of Native communities, but that are not under the Indian Health Service. As we look broadly at the programs within HHS, we have to remember that for many Native communities, non-IHS programs are just as important as those under the IHS. From public health initiatives to social services, these programs often provide the only consistent access to basic supports for the most vulnerable members of Native communities. So, what programs are we talking about? It's Tribal Head Start that helps young children grow up healthy and rooted in culture. It's LIHEAP that ensures tribal elders have heat in the winter and air conditioning in the summer. These aren't just federal services, they're really critical components of the social safety net. And my view is that these programs support family stability, child development, and basic dignity. So today we're going to also hear about HHS programs like FIPSA, which is the Family Violence Prevention and Services Act. This is the primary federal funding stream supporting vital crisis services and shelters for those experiencing family violence. We'll also hear about how tribes are reducing the risk of costly intervention and foster care removals through child welfare services and tribal TANF. These programs help break intergenerational cycles of trauma, support safe housing, and equip Native families with the tools to thrive. Many tribes have built these effective programs over generations, investing their own resources, training their own workforce, so that they better align with their culture and community needs. These are models of local innovation and sovereignty, and they deserve both protection and sustained support. Given the scope and critical nature of these HHS programs, we're hearing growing concerns from tribes and Native communities about the executive order on optimizing the workforce across the federal government and the HHS announcements about reorganization and RIFs. I hear regularly from constituents that are asking, how do these proposals affect me and the delivery of essential services? I want to acknowledge and thank Senator Kennedy for recognizing the importance of IHS very early on. He made clear that they were not going to be subject to those RIFs. Now we're asking for the same understanding for other programs at HHS. And that starts with tribal consultation at HHS on these programs. I think it has to occur early, be consistent, and be meaningful. We know that when tribes are truly engaged in shaping the policies and programs that serve their citizens, outcomes improve, trust deepens, and federal resources are more effectively aligned with local priorities. These programs work best when they reflect the voices of the people that they're meant to serve. Forums like this hearing are also important. This is your opportunity to formally make your case for these programs to the legislative branch, but we also know that HHS will take notice too. I was in a hearing that began at 1:30 before the Help Committee, and Secretary Kennedy was there. I had alerted him that we were having this oversight, and he said if he wasn't in that hearing, he would be here as well, which I appreciate. And I think perhaps some of his team, if they're not here in the room, they might be watching or listening. So I think what we learned today, is not just going to be confined to this room, this audience, but broader. I want to thank all of you for traveling with us to be here today, or if you're here in DC, your journey is a little bit easier, but I know your time and expertise are invaluable. The insights that you share will help inform our continued work to strengthen federal programs and uphold the promises made to Native communities. So I'm looking forward to your testimonies.